Leadership and Delegation in Nursing by Lena Hall. A nurse is responsible for multiple tasks during a shift, whether it be an 8-hour shift or a 12-hour shift. How might a nurse be able to perform all these tasks in that amount of time? The answer is delegation, defined by the American Nurses Association and the National Council of State Boards of Nursing, the process for a nurse to direct another person to perform nursing tasks and activities. When a nurse is in a leadership position, they assist in monitoring the patient's overall care. Giving a patient effective treatment and care can take a lot of work. One of the nurse's responsibility is to delegate different tasks to another individuals who take care of the individual within their scope of practice. The delegation of roles is essential so that the patient's health is being effectively cared for. So why is this important? No matter the environment or the unit the nurse is working in, a nurse's responsibility is to care for the patient. Throughout a shift, a nurse could have many different patients with many different needs, medications, or treatments that need to be done before the end of the shift. How can a nurse achieve all of these tasks throughout a shift? The nurse will delegate tasks to other individuals working to help ensure the patient's care. When the nurse delegates tasks, it can significantly improve the patient care outcomes. There was a 6-year study in New Zealand in 2017 that highlighted on the need for greater clarity in communication, direction, and delegation. The study explained that good delegation was more effective in the workplace, and it helped with the flow of the unit. With effective leadership and delegation, other staff could carry out delegated tasks when the nurse was busy in another part of the unit. When a nurse is planning on delegating, they need planning and preparation, tact, and diplomacy when implementing tasks that need to be done during a shift. What are some defining variables? When delegating a task as a nurse, the nurse needs to understand the surrounding issues and variables. The nurse must provide safe, quality care. When a nurse provides care and is delegating, it can create challenges and concerns, especially when delegating tasks to unlicensed assistive personnel. When a task is wrongfully delegated, this can carry out a significant risk to the patient, the nurse, other staff, and the healthcare facility. Another defining variable that is affecting delegation currently is the world is experiencing a pandemic and the staffing shortage is real. Healthcare is under tremendous pressure and is constantly changing to accommodate the shortage and the unknown factors of COVID-19. Nurses are handling being short-staffed and having a higher patient acuity more than average. All staff, including the nurse, are being pushed harder, doing more work than a typical nurse or staff. The nurse is only able to delegate so much to another staff while also working into overdrive themselves. Unfortunately, the health field is seeing more nurses and healthcare staff getting burned out, which adds to the shortage. For my interview with a leader, I interviewed a fellow charge nurse. It was discussed how they go throughout the shift, delegating tasks or delegating patients to other nurses, and how the charge nurse will create a system to create a smooth, calm environment effectively. During the interview with the charge nurse, he discussed that time is the essence, that he would like to get to a shift approximately 30 minutes earlier than the other staff to ensure adequate time to look over the patients and correctly assign them to the nurses working on the oncoming shifts. He said by doing this, it allowed him to be more prepared for the oncoming shift. During the interview, the charge nurse also discussed how he chose patient assignments. He stated that he wanted to consider the different comorbidities of each patient and make sure that you are not giving all of the harder patients to one individual and ensuring everyone will be able to treat their patients effectively. After the patients are assigned, the charge nurse then looks at what needs to be done with each patient and ensures the unlicensed staff can effectively help each other within their scope of practice. He stated, I will make notes next to some of the tasks that need to be done with a patient and suggest a certain unlicensed staff to assist the nurse with them. Some unlicensed staff have more skills than you might be aware of. The charge nurse will also ensure each individual is working within their scope of practice. Ensuring a smooth shift. After the patient assignments go out, the charge nurse then discussed he will ensure his staff is working effectively and smoothly. He stated medication pass seems to be the time crunch beginning of our shift, so I always make sure that the other nurses are getting the meds out in a timely manner and the patients I am caring for are also taken care of. He then explained, even with the perfect blueprint set out for the night, anything can happen and you need to be prepared for any changes. Communication is key. During their interview, the charge nurse discussed the importance of effective communication and that when you are communicating, it needs to be clear and understood. Miscommunication will open the window for mistakes and the opportunity for errors will then increase. Leadership qualities. The author Doyle discussed that someone in a leadership position needs to communicate clearly with their coworkers when they are delegating a task. If an individual does not effectively understand what they are doing, the chance of error will increase. In the case of working in the health field, this is very important to stress. If there's not effective communication, you're not only putting your license at risk, but you are also putting a person who is trusting you to care for them at risk. In conclusion, delegation is essential in leadership. As a leader, an individual needs to understand how to delegate to whom. It is critical to delegate. Delegating ensures better quality of care and overall better patient satisfaction. When there's not a nursing shortage, it is less likely to cause burnout because it helps more tasks to get done in a timely manner. In the circumstances of delegation, there are many things to consider. The leader should also consider the scopes of practice of other staff, what they are delegating, what the patient needs throughout the shift, and the right patient, the right task, and what is best for the patient.